Claudication is pain, burning, aching, or fatigue of the muscles of the buttocks, thigh, and or calf that occurs with exertion. This pain or cramping is caused by poor circulation because of the blockage of the arteries of the lower extremity. Nearly 9 million people, or 12% of the population of the United States, experience occasional claudication. This increases to 20% in people over the age of 70. Claudication may occur in one or both legs, depending on where the blockage occurs. The pain is brought on by walking or exercise and disappears with rest. Claudication can range from being a mild nuisance to a disabling limitation. Claudication is caused by atherosclerosis in the lower extremities, also known as peripheral arterial disease. Atherosclerosis is the hardening and narrowing of the arteries over time through the buildup of fatty deposits called plaque along the artery walls. As plaque grows, they increasingly block the flow of blood through the arteries. Artery blockages that cause claudication may be in the abdomen, pelvis, groin, thigh, or the calf. Peripheral artery disease is a risk factor for heart attack and stroke, and the major treatment focus is to prevent these serious complications. The aggressiveness with which it is treated will depend on the degree to which the claudication is interfering with the patient's lifestyle. Risk factors for claudication are the same as those for atherosclerosis: advanced age, smoking, diabetes, obesity, sedentary lifestyle, high cholesterol, high blood pressure, and a family history of atherosclerosis or claudication. Your clinician can make the diagnosis by listening with the stethoscope at the area, or also by generating an ankle brachial index, which measures the systolic blood pressure in the ankle divided by the systolic blood pressure actually at the arm. Doctors also utilize ultrasound, CTs, angiographies, or MRIs. The goal of treatment is to reduce the pain by reducing risk factors. You gotta stop smoking. You should walk, usually 30 minutes a day, eat a low-fat diet, and adopt lifestyle changes aimed at reducing cholesterol, blood pressure, and blood sugar levels. Medications such as aspirin to prevent heart attack and stroke, and medications to improve walking distance can be helpful as well. If none of those work, there are medical procedural interventions such as angioplasty, cryoplasty, stents, lasers, and even surgical bypass of the problem area to fix the issue. So if your legs have been hurting and you didn't know why, claudication may be the cause. So see your doctor right away. I'm medical editor Dr. Corey Hebert with your Weekend House Call.